Hello, I'm Richard Cleaver, and I'm standing as an independent candidate in the County Council elections on the 6th of May. I'd like to share a few thoughts with you about the local issue which seemed to be most talked about in the past 10 days or so, Stamford's healthcare provision. There were two particular themes that have been talked about. There's a very strong sense of gratitude for the fact that people have been able to get their first COVID vaccinations and at a location of their choice and relatively easily. And much well-deserved praise for all the selfless volunteers who've helped make this happen. But there's also another theme. There's still much frustration about the ongoing failings of Lakeside Healthcare, and also frustration that the minor injuries unit at our hospital remains closed. At the end of last week, it was reported in the local press that there is uncertainty as to whether there will be any COVID vaccinations available in Stamford for the under 50s, as Lakeside has declined to take part in this next phase of the programme. Also, social media has once again been filled with stories of many patients waiting 20 minutes and more on the phone to get in touch with Lakeside staff. And this follows an earlier revelation that Lakeside refused to recognise its newly elected Stamford Patient Participation Group. It should also be said in fairness that many people feel tremendous empathy for the dedicated Lakeside staff who are trying hard to maintain an acceptable level of service in the face of all the difficulties. I really hope that both Lincolnshire NHS and the trust which runs our hospital can show themselves capable of resolving these problems, and we should strongly support them in their efforts to do so. I will certainly remain committed to campaigning for Stamford to have the best possible healthcare services. I believe that we in Stamford should have a choice of GP services instead of the current Lakeside monopoly, and so would welcome another GP service being set up at the St Mary's site when the vaccination programme there is complete. In the longer term, given the planned addition of 1,300 new homes for the north of the town, there is clearly a case for a new state-of-the-art surgery to be built towards the northwest side of Stamford, and this is something I would support. I will continue to be very active in the Better Healthcare for Stamford campaign group, and I would encourage everyone to join it. Thank you for listening.